Yes, it feels good all the time here on Smooth 98.1. Love music, love life. This is Breakfast in Bed. Time check right now is 8:02 a.m. And then we are in the soul food segment. And to date, okay, I know I didn't tell you the topic before time. I told you to go to our Instagram page and also our WhatsApp status. So right now, I'll be telling you the topic we'll be talking about. The topic of conversation this morning is this: what they didn't tell you, the truth you were not told about skin lightening. Be it skin lightening, be it skin bleaching, be it skin toning, be it skin brightening, clearing, whatever it is. We'll be getting into that a whole lot this morning, at least from now till 9 o'clock or 8:55 thereabouts. So yes, if you have questions, if you have things you want to say, if you have comments, if you have anything whatsoever to drop, you know the number to call is 014489981. Again, 014489981. That's the number to call always. And then the number to send your WhatsApp message to is 0809 444 0981. Again, 0809 444 0981. Now we are streaming live on YouTube, so if you want to be a part of the conversation in terms of seeing behind the scenes and everything going live in the studio, just go to YouTube and search for Smooth 981 FM Lagos. Again, Smooth 981 FM Lagos. If you also want to be a part of the conversation on YouTube, you can just drop your comment in the chat box and then we get to read it out, or whatever it is that you have to say. So I am looking forward to every part of this morning. And I already have my guest in the studio. So if you're in the YouTube family right now, you know that my guest is a very beautiful, the consultant physician. She's a dermatologist at the Lagos State University Teaching Hospital. She's a public health advocate. She's a dancing doctor. Ladies and gentlemen, my guest this morning is Dr. Folakemi Cole-Adeife. Good morning.
Good morning. It's always a pleasure to be on
Thank
the
you so
airwaves.
much. Thank you. I mean, I always appreciate everybody who comes here every morning. It's Saturday. Saturdays are supposed to be sacred, and for you, a medical professional, you get to work all week long. So yeah, I do not take this for granted at all. Thank you.
You're most welcome.
Okay, so in fact, let's start from the little part. Yoruba says that it is the very slim parts that you start to cut the moi moi from. Whoever is Yoruba will understand. In
Yeah.
short, ibi pelebe latin mo leje.
Mm.
Yes. All right. So I actually want to get the difference between skin brightening, skin toning, skin bleaching, and maybe if the umbrella term for that is skin lightening. So is there a difference between all of that I've just ruled out?
Well, there are a few differences. However, in many cases, people kind of mix them up,
Okay.
But skin bleaching or skin lightening is a general term.
Okay.
When we talk about bleaching, we talk about people trying to change the normal color of their skin, for various purposes,
Mm.
usually psychosocial purposes. Um, Toning in some conditions or some situations can be, useful. For instance, part of your skincare routine. A lot of times people tend to use a toner, but sometimes what people refer to as skin toning is just actually a euphemism for bleaching. If you really are talking about toning the skin, yes, as part of your routine, when you cleanse, you moisturize your skin, you can also use a toner. What the toner generally does is to try to help to take off some of the dead skin cells and also balance the pH of the skin. That is the original purpose of a toner.
Yes.
But in this environment, when people talk about toning, they are talking about, changing the skin color. So in many cases, toning is just, an easier word for bleaching. But toning is, there's actually, legitimate or good toning as part of your skincare routine.
Mm.
Lightening sometimes is essential because in some cases people have blemishes, maybe as a result of acne or melasma. There are a lot of skin conditions that actually make the skin tone or the skin color to be uneven.
Mm.
And as part of medical or cosmetic treatment, people can actually be recommended or prescribed skin lighteners to
Okay.
to regularize or even out the tone of the skin, and that is fine. But where we're kind of concerned or have a major issue with is when people have no skin issues, but they just are not really satisfied with their skin color and they want to be much lighter, and then they begin to use various products or creams to achieve that. That's what, as skincare professionals, as dermatologists, we are a bit concerned or worried about. At the end of the day, it's a personal choice, but we always tell people, these are the pros and cons, or these are the cons associated with this. So you are informed, you can make an informed choice, and we generally discourage people from trying to bleach their skin for just the purpose of being lighter.
Mm.
Our dark skin is beautiful. We, over the years, have developed some kind of aversion to our own African appearance.
Yes.
So we kind of tend to relate more with the European standards of beauty, which include, light skin and white skin color, pointed nose,
Right.
the things that make one look Caucasian or features. And we kind of believe that our African features are not as attractive. And I think we should move away from that. I'm glad that a lot of people are now campaigning and accepting or embracing the natural African beauty, which includes our skin color. Black, they say, is beautiful. It is beautiful, and black don't crack. And we're going to talk a little bit about the reasons why we actually have this dark skin color. It's just basically a natural adaptation to our environment. So for thousands of years, our ancestors have lived in a very hot environment in Africa. We're close to the equator, so we tend to have a tropical climate and have a lot more UV, that's sun
Yes.
intensity. And the skin pigment in the pigment in the skin called melanin, when we talk about melanin rocks,
Mm-hmm.
it's basically a natural umbrella for the sun's rays, because even though the sun has some great benefits, it helps us make vitamin D, it helps plants grow. Too much of sun rays, UV rays from the sun, can actually cause damage to the skin, and that damage, if it's not controlled, can result in cancer of the skin, so skin cancers. So over the years, we adapted to have a darker color, more melanin in this part of the world to prevent us from developing skin cancers.
Mm.
So that melanin is like a natural sunscreen, so to speak. So you find that people whose ancestors have lived in Africa for a very long time have a lot more melanin as an adaptation,
Yeah.
while people who live in temperate regions, Northern Europe and other places, have less melanin because they don't really need it, and they need more a lighter skin to absorb vitamin D.
Mm.
So it's basically a natural adaptation, and it's something that we should think of as a benefit in this part of the world. And it's also one reason why people find that when they are in temperate regions, when they travel abroad, sometimes they tend to look a bit lighter,
Yes.
and they say, oh, this Nigeria is suffocated. No, it's just a way of the skin adapting to the environment a little bit, because
Mm.
it doesn't need as much melanin. Just like even white people, you find that during the winter they're very pale, and then during the summer they go out in the sun and they get a bit of a tan. So
Yes.
essentially, that's the exact same thing that happens to us.
Mm.
So generally, our skin color, as you said, is a natural adaptation and it's beautiful, but there are a lot of societal pressures in this part of the world, in Africa generally, and not just Africa, everywhere where black people are. Because I was reading a story on BBC yesterday about a lady who her dad said he didn't recognize her
Yes,
after
I
two
saw that.
years because she had light in her skin. And
Yeah.
when he did see her after 2 years, he was like, "Who's this?" Couldn't recognize his own daughter.
Yeah.
So it's everywhere where we have black people, we tend to feel, pressurized by the societal standards of beauty,
Mm.
and we want to kind of change ourselves. But I think we need to deal with that psychosocially, internally, and just believe and understand and appreciate our own natural beauty.
Mm.
There's nothing wrong in making your skin look beautiful, making it healthy, making it shine. But trying to lighten or change the colors has, long-term effects,
Effect.
side effects that, can be very, very difficult to manage. As dermatologists, we usually see the end results, we are like the last bus stop a lot of times. So we do see people who have suffered from long-term use of lightening creams,
Mm.
for several years, and they come to us, and it's really difficult to manage.
Mm.
The various complications can be really terrible, and most of them are filled with regret because they're always in the most of the people we see are always in the stage of had I known, you
Mm.
know.
Aside.
So at the end of the day, it's good for people to be informed about these things. And then if you still decide to do it, like I said, everyone has a personal choice, but
Yeah.
one must be well informed. And it is our responsibility as healthcare professionals, as experts, to be able to educate people
Mm.
about these, side effects and complications.
Yeah, so that you can make informed choices and you not make it on the altar of ignorance. Meanwhile, I have this message. Somebody said, "Hi, shout out to our dancing doctor, Sister Folakemi. I see you from Spirit of David. I will
Oh,
remain anonymous." All
thank
right, so
you.
yes,
Hi.
yeah, so I will definitely take a break now, just a very short breather. And when we come back, we'll go back to that melanin, the process of removing the melanin, because I actually want to get into how it is done. I mean, how you scrape the melanin that comes to you naturally. And considering the fact that it has been said by the World Health Organization that 77% of Nigerian women bleach their skins. And
Mm.
globally, this industry is currently valued over $8 billion. And guess
Mm-hmm.
who's leading? Black women around the world.
Yep.
So it is very worrisome. In fact, it's very worrisome again that it is women that bleach the most. So I want to get into all of that.
But not just women.
Yes,
Well, we'll
not
talk
just
about, but
women.
men,
Exactly.
majorly.
Yeah, majorly. So
Mm.
yes, that's those are part of some of the things we'll be talking about this morning. If you want to contribute to the conversation, you can call 01-448-9981 and then send your WhatsApp message to 0809-444-0981. Just a quick break. We'll be back. Love life. We are to do something. Just a short break.
Stimulating, uplifting, inspiring, motivating. It's Smooth Motivations every Sunday morning on Smooth 98.1. Do you have the emotional quotient to go through the highs and the lows of what it takes to be successful? Tune in to get the recipe for living. It's everything you will ever need. Smooth Motivations every Sunday from 7 a.m. You have to maintain.
And the best way to maintain your cool is to stay tuned to the station where we love music and we love life. Smooth 98.1, love music, love life. This is Breakfast in Bed. My guest is Dr. Folakemi Cole-Adeife. She's a consultant physician and dermatologist, and we're talking about what they didn't tell you about skin lightening, all the truth. So we're going to be breaking that down. She already started by telling you the how we got the darker skin tone. It's as a result of the adaptation over the years, and it's a natural protection for you, like your natural UV blocker. So please do not scrape it out. And talking about scraping out, first let me take this quick message from Charles Chidozie. He says, "My cream contains arbutin and sunscreen, and it is hydroquinone free. I am a fair guy. I need to maintain my yellow." Hope I'm not bleaching because I hate the thought of that. What?
Well, there are some easier ways of, that are not as harmful. Like I said, sometimes it may be required to use a skin lightener, particularly if a person has some dyspigmentation, meaning that they have some blotches of darker color that can be as a result of sun exposure or acne, hyperpigmentation, acne scars, and that is fine. But using it on a long term or regular basis may not be required. Sometimes what we just recommend people to do is use sunscreen for the exposed parts of the body. For instance, parts of your body that are covered by clothing. You don't necessarily need to use, and because you find that those parts of the body are naturally lighter, you notice that the parts of the body that are exposed to the sun are usually the parts that are dark or darker.
Yeah.
And that also tells you that what gives people an extra tan is the sun's rays. So if that is, how you can manage that is to use sunscreen. Not just any type of sunscreen, because there are a few sunscreens that can actually make a person to be a bit darker. But you want to use a good sunscreen that will protect, the exposed parts of the skin, like the face, the hands. But the feet, those are the parts that usually get dark because of sun exposure.
All right, let me take this quick call. Hello, good morning. Hello. Good morning. What's your name? Chukuma. Thank you for calling this morning.
Good morning. Hello.
Okay, go ahead.
That does happen.
So what's the question?
Yes. Okay, I'll answer that. Yes.
All right, she'll answer that.
So when you
Thank you.
As dark skinned people, our skin is constantly shedding. We're constantly shedding old cells and old skin cells. And some of those old skin cells contain melanin, and the melanin is dark. So sometimes when you have a bath and you use a white towel to wipe your body and you see some brown, it's not necessarily dirt. They're actually dead skin cells that are being shed off, as you have your bath and as you rub it off. So, Mr. Chukuma, it's not dirt. They're just your melanin cells,
All right. I hope Mr. Chukuma's daughter or child is listening too. Hello, good morning.
Melanin containing cells.
Hello, can you hear me? Good morning. Please, can you turn down the volume of your radio set? All right. Where are you calling from? Okay, go ahead.
Wrinkles on which part of the body? Okay, so in a young child, they may have wrinkles if they have very dry skin. When the skin is dry and there's not enough moisture and oil being retained in the skin, some people have very dry skin. And many children have a condition called atopic dermatitis, which can leave the skin to be dry and sometimes become wrinkled. So in that case, if it's a young person, you would want that person, you would want to make sure you use very good moisturizers and emollients. And emollient is something, a skincare product that has a very high concentration of oils in it. And what emollients do is they trap moisture in the skin. For people who have naturally dry skin, they prevent the moisture from being evaporated out of the skin. So if a child has wrinkles, it's most likely that that child has very dry skin and needs a good moisturizer and emollient. And also to avoid very harsh soaps. In our environment, we tend to use very harsh soaps, particularly medicated soaps that can also dry out the skin. So you want to stop using that for a child.
All right. I hope you have the answer to your question, Mr. Ebenezer. All right. You're welcome. Hello. Good morning. Wait, hold on. Do you know the dance doctor personally, or it's because you heard being called the dance doctor this morning? Interesting. Because everybody that called in has been calling her dancing doctor. She actually dances. That's why she's called the dancing doctor. Yeah. So what's your name? Thank you for calling this morning. What do you want to say? Wow. No.
Okay.
Mm. Okay. You had what? Okay.
Oh, okay. Yes. Yes. Okay. Let me answer. Okay.
Okay. All right. All right then. So she definitely will answer your question. Thank you. Just stay tuned. Thank you. Wow, we have a lot of calls coming in, so I'm trying to take all the questions or all the comments we can take so that we just answer everything at once. So, well,
Okay.
you can answer that one before we go to the other ones.
Okay, so about the skin lightening, yes, the skin can be very forgiving. If a person who lightens or bleaches their skin actually stops, it's possible for the skin color to go back to normal because your genes are naturally programmed to produce a particular amount of melanin. We can't really change our genes. So when we stop actively um, inhibiting or stopping the melanin will still come back. However, usually when a person has been using skin lightening products or creams for a very long time, some of the complications that arise, like some skin color changes, skin thinning, may be difficult to reverse. So even if they go back to their normal skin color, they may still have to manage or battle some of the long-term complications of skin bleaching. But yes, it is possible for them to go back to their normal skin color if they stop lightening the skin.
But
Um,
what are those long-term complications of skin
so
lightening?
it depends on the what is used. So a lot of people use steroids or steroid creams to lighten their skin. Steroid creams are very one of the side effects. It's actually used for to prevent or manage inflammation, that's sores and itching and redness, but it has a side effect of skin lightening.
Hmm.
However, long term use of corticosteroids or steroids causes the skin to become very thin, causes a lot of you see people having a lot of visible veins, what we call telangiectasia, and it can make the skin to become very hairy. So you have women having a lot of facial hair, on around the nose, around the cheeks, what we call hypertrichosis. It
Oh.
can also make the skin very thin and easily bruisable. So just a little manipulation can cause bruising and peeling of the skin. And then also with steroids, you have an increased risk of other infections because it actually destroys the skin's natural immunity. So people who use these over time tend to end up having a lot of fungal infections, viral infections on their skin, things that normally the skin would have been able to manage on its own. And so they come with that. A long-term use of steroid creams, the steroids can be absorbed into the bloodstream if there's heavy usage. And we've actually had people have organ failure from the use of steroid creams, and a hormonal condition called Cushing's syndrome, where they just become extremely fat and with high blood pressure, high blood sugar,
All from
and
using cream.
yes, all from using creams. Some creams that contain mercury, lightening creams, can damage the kidneys and cause kidney failure. So a lot of lightening creams used to contain mercury, and mercury is a heavy metal that can damage the kidneys. So kidney failure can result from lightening of the skin. So these are some of the complications. The people who use a lot of hydroquinone is also a very common skin lightening agent. Over time, hydroquinone is used by dermatologists in small quantities, but a lot of the hydroquinone containing creams in the market today have very high percentages, and hydroquinone is not supposed to be used for a long period of time. So over time, people develop this terrible blue black discoloration on their face, on their arms, anywhere that is sun exposed, which we call exogenous ochronosis. So you see these people having around the cheekbones this very dark, terrible looking
Yes,
color.
yes.
That is as a result of long-term use of hydroquinone containing creams, and that is extremely difficult to treat. It's treatable, but very difficult and very expensive to treat. So over time, those are some of the complications. And then also, we haven't seen it yet, so there's no evidence. People may say skin lightening may cause skin cancer. Well, we are beginning to see few anecdotal or few cases, and I think over time we may begin to see more cases. For now, we haven't really seen a lot of people having skin cancer as a result of skin bleaching, but because people are taking off the melanin and they are not really using sunscreen the way they should, we project that in a couple of years we may begin to have, coupled with global warming, the environment
Exactly
is
my
hot,
thought. Yeah.
we may begin to have more
Cases.
cases in dark skinned people of cancers. Right now we don't have that, that's the truth, but it's a possibility, and if we don't do anything about it, we may then begin to have that in the future.
Thank you very much. Thank you so much. Now, you have mentioned hydroquinone, you've mentioned mercury, and a lot of people, just like Charles said this morning, he said his cream does not contain hydroquinone. I'm sure people who have been told many times or who have heard it on one
Yes,
platform or the other check their
their
cream
creams.
to
Yes,
see for hydroquinone.
hydroquinone. But there are some creams they don't actually put it
I
on the
thought as
label.
much.
There's a very popular cream in Lagos. I won't call the name, but it's
Please
an
don't.
orange and white bottle or container. And this cream has a very high percentage of hydroquinone, and it's very, very cheap. So a lot of people, I work in a public hospital, so we see a lot of people using this cream, and they tell you they don't know that it's a bleaching cream, that they just use it because it's not really written, or it's written but in very fine print, and a lot of people don't bother to check, and in the long run it causes a lot of skin damage for such people who use it.
Yeah. I did mention last week, I mean, we talked a bit about it on why you should always check your product, your food items, anything whatsoever that you're buying. Check the label to know what is in there, the ingredients, the expiry date, everything on it, because it is very important. Now, back from hydroquinone and mercury, you already said that some people do not actually write it there boldly. But now let's talk about all these organic creams.
That is one thing that I'm so passionate about, because I tell you, I see a lot of people, and maybe out of every 10 people I see, 2 to 3 of them, the source of their problem is the use of organic, in quotes, creams.
Organic.
Because you find that, and then we decided once to, okay, let's analyze, and then you see people saying they're using a totally natural organic cream, having frank complications of steroid use. So I will begin to wonder, this organic cream, did they put some steroids in it? And sometimes when we analyze one, yes, we did find a very potent corticosteroid as part of one of the constituents of that cream. So it's very, very sad that a lot of these, in quote, organic creams are totally unregulated in our environment, and anybody can just mix any set of chemicals or creams and sell and tout it as organic and sell it to people on social media or in the market or in stores without any regulation. It's really, really alarming, and a lot of people know that what people want is to look more fairer, to look fresher, lighter. And the truth of the matter is that steroids and other lightening agents will give you that in the short term. And then after a couple of months, or maybe a couple of 1 or 2 years, you begin to have the side effects. So I have a lot of people saying they're using organic creams, and then they develop all these terrible skin complications. They come to you and say, oh, I'm not using anything else apart from the organic cream. And I've been using this cream for like a few months. My skin looks great. I'm like, okay, let's try stopping this for a while, and let's see if these problems will resolve. will resolve, and they do. And then they are like, oh my god, I never believed this cream was like this, or I didn't. I would advise people not to. If you really want to use natural products, then go and buy coconut oil or shea butter. When you tell people that, say, oh, it will make me dark. Oh, so
So you
your
know.
so your aim is to use something that's going to make you lighter. And that's when you know that people deep down inside may
They know.
actually know what
Yes.
they're doing, but
Yes.
they just need some validation by saying
Exactly.
that,
To make
oh,
them feel less guilty.
yes. So a lot of these organic products, I would say, they are very, very dangerous and risky. If you are going to use, there are a few good products that are properly processed, properly curated. They write what is in it on them and all. But once your in quote organic product starts lightening your skin, or you need to be really careful, and it may not really be. And I always tell people that because something's organic doesn't mean that it's the best.
Right.
Where anything you're putting on your skin has to be tested and trusted that it is safe for human use. So it's not just about, and there are some natural products that can be harmful to the skin. Like in this part of the world, please do not put lime juice or lemon juice on your face. Because even though it's totally natural, it's what you call a photosensitizer. It's going to attract the sun's rays to your skin and cause burns or darkening ultimately. And I've seen quite a few people like that. In Europe, you can probably get away with it because they don't have as much sun as we do here. But here, you'll be asking for a lot of trouble when you use some unprocessed natural products. So because it's natural doesn't mean it's automatically perfect. It has to go through some processes to be safe for use.
Yeah. So no addition needed for that one. So that tells you that some of the things that you Google up and those do it yourself.
DIYs, yes,
Exactly.
you have to look at them in the context of where you live, remembering that we don't all live in the same environment. It's just like some certain boots, they are impractical to wear in Nigeria because you'll be hot, and certain clothing. So when you see people talking about some DIY masks, face masks and things, you have to think about this person, where do they live? And where do I live? Well, is it going to, give the same results?
And even your job. I mean, if you're using that kind of thing and your job requires you staying in the sun for long, come on, you know that it doesn't make so much sense.
And if you're really averse to tanning, if you know that your work is going to make you to be in the sun for a long period of time, you must invest in a lot of sun protection. Sun protection includes clothing and creams. So you want to make sure that you have a sun hat, have sunglasses, you could have a scarf for your neck, because the neck is also a place that is exposed. And then sunscreen. Sunscreen is actually made to prevent sun tanning and sunburns. Rather than lighten your skin with a toning cream or lightening cream, you can use a sunscreen to prevent darkening. And that, will also have, that's what's recommended, or will have a good effect. And above all, try to minimize sun exposure as much as possible.
All right. Thank you so much. It's been an interesting conversation. So I have this question from Emeka at Ojo. He says, good morning, Olusegun. The skin lightening, I mean, changing of cream always wants skin to be different color. It irritates. Okay. I'm changing of cream, I guess. Doctor, do surgery cut or healing easy on that constant use cream? All right.
Okay.
I'm guessing you're talking about a skin lightening. So yes, I mean in terms of changing creams, and it has an effect on your body. It makes you, there are people who are switching between creams, and
Yes. So I understand what he's trying to say. That some people just keep switching from one cream to the other, looking for the one that will have the best effect. Because what happens is when you start using one cream and you start developing some of the complications of that cream, you feel, oh, maybe this one is not good. Let me try another one. And that one still gives the same effect, and then you try another one. So there are a lot of people like that switch from one cream to the other, trying to find the one that what they believe is, oh, this cream is not suitable for my skin. But what is actually happening is that the ingredients or the active agents in that cream are damaging the skin, and chances are most lightening creams will have similar agents, so the damage continues. So the only solution in that case is to stop using them. It's a bit harder, it's a bit harder than it sounds for some people, because some people, for some reason, they just want their skin to be lighter. And we see a lot of people like that. And no matter what you tell them, they are not ready to listen to you. They're like, doctor, you have your skin is a bit fair. I'm too dark. People think, and it's so funny because a lot of patients tell me, people will be telling them that they are dark. I say, what's wrong with being dark? I say, no, it means that maybe I'm suffering, or maybe I'm like, who
Societal
says?
beauty standards.
Yeah, so we really need to address those. And it starts with the media, actually, because people are moved a lot by what they see on television, in adverts, in social media. There was a time in Nigeria that every single billboard person was a light-skinned person. Even India has the same issues. When if you visit India, you find that majority of people are actually dark.
Yeah.
But if you watch Indian movies,
They use more white
you
people.
only see the very fair people. So Asia also has a very big issue with skin lightening and skin trying to tone their skin. Everybody wants to be fair, But I think it starts from the media. When the media starts to embrace beautiful, dark, beautiful people will then see people that have their own skin color on television, on billboards, and say, "Oh, she looks like me." But if everyone on the billboards, on the TV, looks like a very fair-skinned person, then most children will grow up and aspire to look like that. So that's one way to help change societal standards.
And talking about media, one of the things we talked about last week was a comment from an actress, Charity Naji. She was complaining that Nollywood producers and filmmakers actually don't go for the dark ones because they complain that the skin color does not come out on camera.
Yes.
What is that?
That is actually a thing. It's actually a thing not just here but in lighting and movie producing. They go with the standard of the light skinned person. It's you need to learn, or people need to learn how to light for dark skinned people.
Exactly.
Because the thing is, most people who go to film school or learn how to make movies do not learn the lighting processes or procedures for our dark skin. So when they just copy and paste what is taught in film schools or by videographers from abroad using light skinned people, they don't get the expected results or outcomes for the way the motion picture looks.
They should just do it, please. Just do
So
the right thing.
there needs to be a lot more training on lighting for dark skinned people.
Yes.
And that can solve that problem.
Hello, good morning. Hi, what's your name? Grace, calling from where? Ikorodu, thank you. So what do you have to say? Okay.
Okay, thanks
All right,
for that
thank you.
question. So other than the sun, there are actually a lot other things that can cause darkening. One of them is actually hormonal. You can have hormonal changes, especially in females when we reach that reproductive age and we're using things like birth control and things like that. Some of those things can actually cause hormonal changes. And as we get older, a lot of women experience something called melasma, which is related to hormones. So it's not just the sun that can darken out. There may be also some hormonal, changes. Also, some medications can also cause a bit of darkening of the skin. So if you are concerned about, the face being darker, you can actually see a dermatologist or a well-trained esthetician, and they can look at your skin and manage the concerns and give something that is not bleaching but will help you to manage your skin color. And please use sunscreen. A lot of people say, oh, I'm not in the sun, but you're indoors and you have this huge window that has that the lighting is coming in, so the UV rays can actually go through that window and you'll be getting a healthy dose of UV rays that can cause tanning or darkening of the skin.
All right, then we have stream of messages here. I'll start with this one from Jonathan. He said, "Did the doctor say sunscreen or sun cream?" It is sunscreen. Sunscreen, right? I have this one from Namdi from Ebute Meta. Says, "Good morning, Sheon. Good morning, doctor. Good morning to you too. Please, can I mix baby oil with normal creams because I have a dry skin?
Can you mix what?
Baby oil
Baby oils.
with cream because he has a dry
Yes,
skin."
you can. Actually, do recommend that for some people who have dry skin. So you can use if you're using a lotion. The lotion tends to have more water, and if you have dry skin, you want to look for something that says cream. So with lotion, you can add an oil into it, baby oil, coconut oil, and then use that on your skin. That can work pretty well.
All right.
Or you can just look for a cream rather than a lotion, because creams have more oil than lotions.
Okay, in case you didn't know, I guess that already puts it to rest, that they puts it to rest rather, that there is a difference between lotions and creams.
Yes.
That's a common one that is commonly misbelieved, I guess, a misconception. So there's this one from Fast Lane from Ikeja. He says, "If I use sunscreen and avoid sunlight enough, will the darkened part of my skin be reverted to default color?"
If he uses sunscreens long enough.
And
yes.
ah.
So if you use a good sunscreen that prevents sun tanning over time, let's say usually it's not automatic, it's not overnight, but it takes time, and if you use sunscreen appropriately. So the challenge with sunscreen is, the application. A lot of sunscreens, or most sunscreens, have to be reapplied every 3 hours.
That's stressful.
Yeah, that's a bit stressful. So, sometimes if you are not very religious with sunscreen use, you may not get the desired effects ultimately. But even if you don't use it that frequently, over time you will still achieve some, benefit from using the sunscreen. So yes, if the main cause of the darkening of your skin is sun exposure, if you use a sunscreen more frequently, ultimately you'll end up having, a reversal of that tan.
All right, so there is also another one from you call yourself anonymous. Let me just tell you the truth. I'm looking at your name here, but don't worry. He says, "Hello, doctor. Please, I would like to know if there are any side effects as to not using cream. It's been almost 10 years since I last used cream. I think I have an oily skin, so I sweat easily when I rub cream back. So then I stopped. Any side effect?" I'm sure there are a lot of guys on this table.
Yes, a lot of guys are actually. There's no side effect other than, maybe if in dry weather you may have some, cracked grayish looking skin. And when you're young, you can get away with that. But as you get older, you may need some assistance, to help moisturize or nourish your skin. So I think that is not a big deal if you feel you look okay, but don't take your own opinion for it. Ask a friend if you look fine, because a lot of guys, they look very scruffy and they are totally not aware that, oh, their skin looks like that. So if you ask from some of your female friends if your skin looks fine without using a cream, then by all means, enjoy it. There's some soaps that have a bit of moisture or oil in them, so when you use them, you may not necessarily need to use a cream if you have, like you said, oily skin. But please do not take your own word for it, because a lot of times we can't see our chin, we can't see,
Yes.
the things about us that, other people may see. So just ask around before you conclude that you don't need any cream.
And my own jar of that advice is that you should ask a lady. In fact, ask many ladies, because if you ask your guys that are always hailing you as chairman,
Yeah,
those people they
yes.
won't tell you the truth.
Yes.
Your skin may be ashy, and they will tell you, boss, you fine now, no worry. So please ask a lady.
Yes.
Okay, so this one coming from Mojisola, a little bit different, but then let's just quickly take it. She says, "Good morning, Dr. Fola, and thanks for this very informative session. Please, I noticed that anytime I use the regular deodorant, it itches me seriously, that it results in peeling as a result of scratching my underarms. So I changed my deodorant to one that is a stick deodorant and no more itching again. So just wanted to ask for the cause of the itching, because it makes me feel very uncomfortable."
So probably you just have an allergy to one of the active agents in the deodorant. A lot of people have allergies to various skincare products,
Mm.
and what you've done is the right thing. You stop using it if you have an allergy to it, and look for what works for your skin.
All right then. Hello, good morning. Ish. Please call back if you can. The number to dial is 014489981. 014489981. Charles Chidos, yeah, I saw your message, but no, I am not reading this one on it. All right, so this person said, I don't know the name of the program. The name of the program is Breakfast in Bed. Good morning, all. I think those claiming organic product are in denial of the truth of what they're doing. Also, all those multiple color people have and are making their skin ugly. Isn't it skin cancer? Thank God for the Oluchis, the Agbanis, the Tuneses of this world. Osa from Abuli Egba. Let me quickly take this call. Hello, good morning. Good morning, what's your name? Osa. Is it your message I just read? Ah, nice. Okay, what do you have to say? You've not what? Look at them. Ah.
Okay. Hmm.
Hmm.
Hello.
Yeah, we missed the last thing you said. What did you say? Hmm. Okay. Oh. Okay. Shoot.
So there are some people that actually have, what we call hyperhidrosis, which is excessive sweating.
Sweating.
That is, a known medical condition, and for that you may need to see a dermatologist for treatment.
Yes, you have to. Don't worry. Just stay tuned till the end of the program. I'll call out how you can contact her. Thank you. Yes.
Yeah,
Eh.
it can be. If it's a problem for you, some people are able to manage it, and it doesn't give them too much stress. But if it's a problem for you, then you know.
All right then. Thank you for calling. Have a good one. Bye. Okay, so Daniel from Mushin says, good morning, nice topic for the weekend. My name is Daniel from Mushin. What about varicose veins? Any relationship with dry skin? I have a dry skin and I'm dark in complexion.
Okay, well, varicose veins are not necessarily related to dry skin. People can develop varicose veins if they have some, what we call venous insufficiency. Sometimes the veins may just not be as strong or as elastic as they're supposed to be, and they don't take blood. I mean, they don't. The blood doesn't flow back up the way it should.
Mm.
So, some people have that familial, so it's like a natural tendency. Others, as a result of the work they do, if they're standing a lot, and some people it can be related to if they have something in them that is putting pressure on the veins.
Yes.
But what happens is we do see a lot of people who lighten their skin having visible, distended, superficial veins. That's a bit different from varicose veins.
Mm.
It doesn't affect people with dark or dry skin most, except they have other possible causes of it. And if you have dry skin, as you said, the most important thing is to use a good moisturizer and what we call an emollient that has more oil, and you want to make sure you keep your skin well moisturized.
Okay, I'll take this quick one again from Namdi. I decided to take it because it's something that should be talked about, even though we do not have the time. He said, one more question. Why do I see some people with dark patches around the armpit region or even around the butt region despite wearing clothes? This one is very important because one, I know it's one of the reasons why some people decide to bleach, or in fact there are specific creams for that area, people who peddle those creams. Plus it's the results why some people have low self-esteem and they're constantly wearing some certain kind of clothing. So
some people generally tend to have slightly darker armpits. Like I said, it could be a hereditary problem or a hereditary thing, not necessarily a problem. It is not unusual for the skin in the folds, the armpits, the groin area to be slightly darker than the other parts of the body because the skin is not stretched like it is in the regular skin. So that can be an issue. However, there are also some products, skincare products that, like the other lady spoke about, some people may have a bit of an allergy to certain deodorants and perspirants. And another thing is shaving because you notice that even guys when they shave their beards the area tends to be slightly darker, so a similar thing can occur in the armpits as well. If one has dark armpits, you just need to try and use a good moisturizer. Look for a sensitive a deodorant for sensitive skin
Mm.
in case you're reacting to that, and use that.
Okay. We've got a lot of questions and comments this morning. There were some questions I even wanted to ask that we were not able to take, but then
Like
I
what?
am glad that we were able to deal with this and
Right.
answer people's question because right now we have just 2 more minutes.
Oh, okay. Time has really flown
It
by.
really almost an hour of talking about skin lightening and everything. Well, not everything, but to a large extent, I hope that you have been able to get some new knowledge on this topic.
Yeah, there's this new trend, if you just say, of people lightening by using injectables and IV. Well,
Right.
there's not much research on this, but I would just say people, whatever you do, be cautious about, don't just go with any fad because by the time we start learning about the side effects, you may have gotten a few complications of it.
Hmm.
So generally, love your color, no matter what color it is, and take care of your skin. Eat healthily, that's very important. Use good skincare products. And if you have any blemishes or issues with your skin, try to see a dermatologist, to have them resolved. Don't just go over the counter and buy things that may end up causing more damage than good to your skin.
Let me quickly clear this one up. Okay, two things. First, it has been said that people who bleach have a characteristic foul body odor. Is that one true? Number one. And number two, there are people who these organic creams actually they tout vitamin C being a very potent ingredient and some other natural vitamins and minerals and what have you. So I am asking, so lightening the body or different parts of the body naturally without any effect, can it be done?
Well, there are a few things. Okay, the first question, which is
Body
about
odor.
body. Yes, so yes, for some people who do use certain products long term, particularly hydroquinone, there is a byproduct that, when it's absorbed into the skin, it can produce, which is a kind of chemical or amine that can cause a slightly fishy body odor smell. So that does occur, particularly in people who are using hydroquinone containing creams long term. So yes, that is a thing. For the use of the second question, you mentioned
Yeah,
the
vitamin C
vitamins.
and all
Yes,
that.
so vitamin C does have a very good brightening effect on the skin, and vitamin C serum is one of the things that you can use to make your your skin look a lot nicer and more beautiful. So there's no harm in using vitamin C on your skin. However, you must also, when you use brightening products, you have to make sure that you use a sunscreen alongside those things because you know, that will help to maintain. There's no point using all these skincare products. They go out into the sun and the sun just,
All right.
spoils all the work and effort in your skin investment.
Hello, if you can say what you want to say in 5 seconds, I'll allow you to talk. Good morning. Yeah, what's your name? Gary, been a while. So quickly, very quickly, what do you have to say? Oh yeah. Okay. Okay. All right, then she will answer your question. Thank you, Gary. Stay
No,
close.
no, you just have a good sensitive skin, and all those products or things you were mentioning, I don't see the reason why you even need to use them in the first place. So yeah, some people do have sensitive skin and react more easily to skincare products than others. So I'll just suggest that you stick with that. That's how your skin is, and it's not really a problem since you know what works for you.
All right, then. Thank you so, so much. If people want to reach out to you, how can they do that?
My social media handles at Flaky Dancing Doc on
That's it.
Instagram, and you can reach out. And I always advise people, we have dermatologists in all the teaching hospitals in Lagos. If you need to, if you have a skin problem, don't just go to anyone and buy anything. See a dermatologist. Go to Luth, go to Lasuth, go to Federal Medical Center, Ebutemeta, to book an appointment with a dermatologist. Also, a lot of private hospitals have dermatologists. Try to see a dermatologist for your skin concerns. Usually, it's better to see a specialist earlier. You have a better outcome, and also you end up spending less, going around in circles. You can get the right treatment for your skin earlier. And love your skin color no matter what color it is. Take care of it. Every skin color is beautiful, especially black skin.
Yes, thank you. I know I said I wanted to talk a bit about why women tend to bleach more compared to men, but sadly we do not have that time. But thank you so much for everything that you have given to us today. It has been really wonderful, informative, like people said, and also clarifying. So thank you again. In case you do not know the full name of my guest, she is Dr. Folakemi Cole-Adeife. She is a consultant physician and dermatologist at Lagos State Lagos State.
University Teaching Hospital.
Thank you. University Teaching Hospital. You can find her on Instagram at Flaky Dancing Doc. That is FLAKY Dancing DANCIN. No G. Then DOC. And reach out to her. Do not ask for free consultation, please. Thank you. All right. So
Come to the teaching hospital. Consultation is free.
yes.
If you want a free consultation.
Okay, you heard that. Thank you. So now if you have missed this conversation, it's totally fine. It's up on YouTube, and then you just search for Smooth 91 FM Lagos, and you can catch the replay or any part of it that you didn't get clearly. And also you can share the video with somebody who you feel needs to hear this information and every other thing that has been said. Stay close because in the 9 o'clock hour, which is a minute, I have my guest. Her name is Zainab Balogun Nwachuku, and it's going to be a very, very wonderful conversation in the Smooth Explorer. This is Breakfast in Bed on Smooth 98.1. Woohoo! Thank you so much.
Thank you.
What's up, Nigeria? It's your
Thank you,
girl,
YouTube
Leo.
family, and we are done.
Listening to the smoothest
Great.
style on Lagos Radio, Smooth 98.1. Don't touch that